So welcome everybody to the Soul Science Podcast, and I'm very excited to interview Kim Vopni of the Vagina Coach. And I'm excited to have this conversation because I think it's so important for a lot of women to understand this information, and we need to educate more people on this. So Kim is a self-professed pelvic health evangelist and is known as the Vagina Coach. She has a BA in psychology and a postgraduate certificate in health and fitness. She's a certified fitness professional who became passionate about spreading information on pelvic health when she was pregnant with her first child. She is a published author, a passionate speaker, and women's health educator, as well as a mom of 2 boys. Kim is the founder of Pelvine Wellness Incorporation and a company offering pelvic health programs, products, and coaching for women in pregnancy, motherhood, and menopause. She's also the creator of the AB System, a revolutionary birth prep and recovery system for pregnant women. She certifies other fitness and movement professionals to work with women with core and pelvic floor challenges through her Core Confidence Specialist certification and pre-postnasal fitness specialist certification. Welcome, Kim.
Thank you so much for having me. Pleasure to be here.
Thank you. So can you first share how you ended up becoming the Vagina Coach?
Yep. That was the question I get. It's certainly not something that I grew up thinking that I would become. It was in 6th grade and I watched a childbirth video in our sex ed class. And I remember thinking, I'm never going to do that. But I went home and I looked at my mom a little differently and I started to have this kind of fear fascination with childbirth. And growing up, my statement was always, I'm never having children. And then when I got married and decided I did want to start a family, I was really determined to have a different story than my mom's, who had had episiotomies with both of her births. She had surgery for incontinence. She had chronic back pain. She had a tummy that wouldn't flatten. So I really wanted to avoid all of the issues that she had been dealing with. And that's how it started, really. So I was pregnant and I was asking my midwives what else, I knew about perineal massage, but what else could I do? And they had recommended a product to me called the Epino, which is a biofeedback device for pelvic floor training. And it's manufactured in Germany. And so I purchased this product and I believe that it contributed to a positive birth experience. And then afterwards I said, well, I had this great experience. Yes, I used midwives. Yes, I had done some research about birth positioning, and I feel like I did a few things that others may not have, but I felt like this product played a role in my positive experience and wanted to share that. So I contacted the company and asked to become a distributor. And I actually didn't intend for this to be a business. I thought I would just have a little bit of side money. And it was a side thing for a few years. And then in 2009, I was laid off from my corporate job. And prior to that, I had worked in fitness as a profession for about 6 or 7 years. And I decided to recertify my personal training certification and apply it specifically to birth. And so that's how it started. I was laid off, wanted to get this product into the hands of more people, recertified. So this is in 2009, recertified my fitness and initially started working with pregnant women. And then looked at postpartum recovery as being something that was also overlooked. So I formed a second business called Bellies Inc., and that's where the AB System was created and the certification programs. And so I was running 2 businesses for a while. And my handle at the time was fitness doula because I was really working predominantly with pregnant women and new moms. And then I think it's about 5 or so years ago now, I had been asked to present at a women's entrepreneur conference. It was called the Mompreneur National Conference. And my talk was how optimizing your pelvic health can make you a better mompreneur. I came up on stage, and up to that point, all the speakers had been some sort of a business coach. And when I came up, I said, well, now you have a vagina coach for your business. And it kind of came out as a joke, but it was also a bit of a light bulb moment. And I said, fitness doula is no longer resonating because I'm now working with people in all stages of life, including menopause, and vagina coach seemed to encompass everybody that I was working with.
Mm-hmm. Wow, that's quite a journey. Um, so can you share exactly what conditions do you help
Mhm.
women with?
Yeah, the two most common are incontinence and organ prolapse. Pelvic pain is also in there. I pelvic pain is definitely something that I will refer on to pelvic health specialists, pelvic health physiotherapists. But a lot of people still will come to me either in conjunction or collaboration with, or some people don't have access to pelvic floor physio. So pelvic pain conditions can come into there as well. But the two most common, hands down, are incontinence and organ prolapse.
Mm. And in the past, there were a lot of women who were having surgery, right, for the prolapse.
Yeah.
So you're saying that there's a way to heal this naturally.
For the most part, yes. So there's, I think often what happens is because there's really not a lot of information shared around pelvic health,
Mhm.
that and we have media messages that imply that it's just normal or part of being a woman, or we get messages from either previous, say family members, aunts, uncles, mothers, not uncles, sorry, aunts, mothers, and also maybe our primary care physicians, that it's just part of menopause, it's just part of being a woman, it's because you've given birth, it's just what happens. And so we accept these, and a lot of people suffer in silence, just thinking, well, I just have to accept it because that's just the way that it is. And then when they finally seek help, they are often then either given medication or referred to a specialist. And the specialists are typically urogynecologists who are surgeons, and they're put down the surgery track. And surgery can be an absolutely life-changing option. It could absolutely be the best for somebody. However, it's often pursued without all of the other conservative options being pursued ahead of time. And that's the challenge, I think. And I believe that surgical outcomes, should they be pursued or chosen, would be better if people were given the information ahead of time and maybe given an opportunity to optimize their pelvic floor function first. So in a lot of cases, I do believe that surgery can absolutely be avoided. But I will say, if people do choose or have to have it, I don't want people to feel shame around it either. I want them to have the information about how to prepare for it and how to recover.
Yeah, and I work a lot with people who are in physical pain, and the physical part is only just one aspect of it. There is so much to a person and an individual, and sometimes they have all these surgeries and they still end up in the same place. And I do agree that, yeah, for some women, this is the surgery is the only way to go, and they will have great results. But sometimes for the majority that don't, there's other things we have to look at.
Yeah.
Um,
Yeah, I
and
think with sorry to interrupt you. The thing with surgery that I think is the biggest missing link is, for some people, surgery can eliminate naggy, bothersome symptoms, but it doesn't fix what contributed to the problem happening in the first place.
Mhm.
And so the potentially movement strategies, breathing strategies, compensation, whatever, all sorts of things, if those aren't addressed, then most likely there will be a recurrence. And once you've had surgery, there's now scar tissue, and scar tissue can be a contributor to pain. And without the knowledge of how to mobilize that tissue and how to optimize muscle function, the pain can either be exacerbated to what it was before, or it could show up for the first time. And then people are stuck thinking, well, I eliminated this symptom, but now I have this symptom, and which one is worse?
Yeah, yeah. Or they suffer in silence and then they go back to the pads and everything and feel like, oh, this is it. This is my life.
Yeah,
Um,
exactly.
yeah, brilliant. So I'm sure there's people who are skeptical that we can do that. Um, so also there's a lot of so our goal is to educate people, right? So
Right.
we want to address even younger girls and younger women to start the process and educating them that it's important that we do have a pelvic floor and there's ways to strengthen that. What
Yes.
advice would you have for them?
I wholeheartedly agree that the conversation needs to happen much earlier than it is. And in England, there was a recent announcement that the NHS is proposing that pelvic health is taught to school age children. And I've been saying this for years, as many of my counterparts have as well. If we could introduce the concept of the powers of the pelvic floor, the importance of the pelvic floor, all of the functions that it has, and how we as vagina owners can support it through all of the life stages that we go through, I think the world would change. I really, truly do. And I often say that the pelvic floor needs the same PR that the dentists have. So from a young age, we have been told to brush our teeth twice a day and floss and see the dentist once or twice a year. And we go even if we don't have a toothache. We go for our preventive health.
Yeah.
And if we did the same for our pelvic health, again, I think that the health outcomes for so many people could be drastically changed. And so when we're talking about menstruation, when we're talking and teaching about body health and sexual wellness, introduce, this is the pelvis, this is the pelvic floor, male and female anatomy both have it. Female anatomy is slightly different to accommodate childbirth. There's hormones, there's menstruation, there's pregnancy, childbirth, all these things that can influence those muscles. And it's extra important for vagina owners to be taking care. So if we planted that seed and then also talked about how once you become sexually active, there are these professionals called pelvic health physical therapists or physiotherapists, depending on where you live. And we benefit from seeing them once a year, just like we see the dentist for preventive maintenance, then how much suffering could we avoid? Really, like it really could be transformative.
Yeah. Yeah. And it really is. I'm also a massage therapist and work a lot with the psoas muscle, and our pelvic area is our foundation.
Yes.
If that's not healthy, then it impacts everything else in the body.
Yeah.
So,
Yeah, absolutely. It's the foundation of our core. It influences our breath. The psoas is directly tied into the pelvic floor as well. Fear is a huge part. Trauma is a huge part. And even activities that we do sometimes, if especially high level athletes, or fitness has become much more intense, and we need to appreciate that the female anatomy is fundamentally, biologically, biomechanically, physiologically different than men. We aren't small men, as Dr. Stacy Sims says, and we need to appreciate the differences. We need to appreciate the menstrual cycle. We need to appreciate the changes in posture that we have. The hormone changes, everything needs to be accounted for. And it manages our continence. It contributes to our core stabilization and control. It is a part of our sexual wellness. It's a sump pump action from moving lymph and what have you, like really, really important jobs, organ support. And it's overlooked. People just aren't given and it's not until we have a problem that people are then thinking, well, why didn't anybody tell me about this beforehand? And yeah.
Yes. Yeah. And there is you touched on a little bit of the shame and everything that can go along with that part of the body. And even just talking about saying the words vagina and all these words can give so much shame. So yeah, there's a lot in this area of the body.
Yeah.
And it is a taboo topic, and that's our goal, is to educate more people and to just let more people know.
Yeah, exactly. And I remember a colleague of mine who she's a nurse continence advisor. So really she works in a very similar capacity to myself. And she had done a TED talk, and I was talking about how one day I'd like to do a TED talk and what I wanted my title to be, which included the word vagina. And she said, well, you'd have to be careful with that wording choice, because vagina is one of the most hated words in the dictionary.
Wow.
And, yeah. And I thought about that. And I also said, you know what, I have stepped into this title. I chose it, one, because it was kind of funny at the time, and it makes people stop and say, pardon, did you just say that word? But also it is a word that everybody hush hushes when they say it, or they say, and I use slang terms as well, because it's funny, right? But we need to talk about it. It's an anatomical term, and we need to say it. And I said, all right, I'm just putting it out there, and here we go. It's vagina. And if it makes you uncomfortable, well, I'm hoping that with more and more of this, that eventually it'll just be another word like nose or elbow.
Absolutely. Yeah. And I joke that if you see the Amazon logo, it's a penis.
Yeah.
It's okay to have that logo out there in the world, but we
Yes.
can't say the word vagina. Or even somebody was helping me with a logo, and my friends were like, that looks like a vagina. And I'm like, and
Yeah. Good. Yeah.
I didn't go with it, but yeah, it's just interesting how much words influence our
Yeah.
feelings.
Yeah. Yeah.
Um, okay. Any other advice for the women out there who are living with continence and all these other things?
Yeah. My main messages are, do not accept pads as your destiny. Do not continue to suffer in silence. There are so many things you can do. My number one recommendation is always seek the help of a pelvic floor physical therapist. And I say they should be our first line of defense, not our primary care physicians. We need medical people on our healthcare team. We absolutely do. I do believe we need a village, and pelvic health physical therapists as our first line of defense will be a much more thorough evaluation, provide you with a huge understanding of your body that you will walk away thinking, how is it I've lived for 30, 40, 50 years in this body without knowing that? And they can screen for medical conditions. And if they consider that it would be it's something you need to have addressed medically, they will say, go see your primary care physician. But the reverse doesn't happen. When we see our when we see our primary care physicians, very rarely, unfortunately, are they saying, go see a pelvic floor physical therapist. Mm-hmm. So depending on where you live in the world, there are different insurance and different healthcare plans and what have you. Generally speaking, there are many private pay pelvic floor physical therapists where you do not need a referral and you can simply make your own appointment. Depending on your insurance provider or your healthcare plan, some do require a physician to refer. And if your physician says no, find a different physician. Advocate for yourself and go until you get that referral and see that physical therapist. You can Google pelvic floor physical therapy in your city. You can also go to pelvicguru.com, which is a global directory. American Physical Therapy Association, Canadian Physiotherapy Association, NHS. Basically, Googling pelvic floor in your city will generally bring up somebody at least nearby, which hopefully is somebody you can access. So many people then will often say, well, it's expensive. Yes, it can cost you probably $130 for that initial appointment. But even if you just go one time, it truly will transform your life. And if you think about, I've done many posts on this, I call it pad math. If you add up how much money you are spending on pads each month in our lifetime, for people, generally in our 30s, a lot of people are dealing with incontinence and wearing pads every single day. It could add up to $20,000 to $50,000 over a lifetime. That wow. Yeah, it's a lot of money. And so spending that $135, even if you have to spend, say, $300 in a year to have a few sessions, you could eliminate pads. And the life quality that you regain from that can truly transform your life. So do not accept the messages that media sends to you or the messages that anybody will tell you that it's normal or just part of being a woman. Absolutely not. I call BS on that 100%. Pelvic floor fitness is really, really important. Learning how to do Kegel exercises correctly. And then I take it a step further and say, coordinate it with movement is really, really key. They're not a quick fix. It is something that you will be doing for life, really. But it doesn't take a huge amount of effort or time out of your day. It's 5, maybe 10 minutes a day. So invest the time, invest the money, because you're worth it. And pads do not give you confidence to carry on with your life. They really don't.
And yeah, when I talk about money, it's your quality of life. And if we're not spending money on things like this, then we're spending it on being sick and eventually not feeling well. So we're going to spend it on something. I'd rather spend it on something that's going to have a long lasting result and get to the root cause instead of just putting a Band-Aid on it. So
yes.
Yeah. Yeah. So I see that you have a Buff Muff challenge. Can you share for the listeners what that is?
Yeah. So I recognize that, again, Kegel exercises are one of the most most people have heard about a Kegel exercise, but it is quite an elusive exercise. So it's often prescribed. People will say, well, make sure you do your Kegels, or doctor might say, go home and do your Kegel exercises. But very rarely is it taught. Very rarely are people given a true evaluation to understand how to do them. And so that's one thing that pelvic floor physical therapy can do. But I understand that not everybody has access to a pelvic floor physio. So I wanted to provide a platform, a program that gave people the information, the visuals, the cues to help them access their pelvic floor, bring it into movement, because our pelvic floor needs to be trained dynamically, not just sitting in our car at every red light and doing a few squeezes, right? And so I combined, my fitness program for fitness background with pelvic floor education and put it into a 28-day program. And it's 10 minutes a day. It's full body. There will be down training or release type exercises where we learn how to release tension that can sometimes interfere with the function of our pelvic floor. And then we bring our pelvic floor activation into movement, full body movement. So functional type, activities of daily living even, or workout type style exercises that really truly within a short period of time can help eliminate back pain, can help eliminate incontinence, can help eliminate or reduce prolapse symptoms. And again, within 2 to 4 weeks, so it's a 4-week program, many people have ditched the pads and gone back to having satisfying sex again, or not thinking about their prolapse all the time. So it's an app-based program. You get a daily reminder. You have a 10-minute workout to do. There's a chat function where you can connect with others. You can ask me questions. You get points for completion. There's bonus content in there. And at the end of it, people walk away and they think, oh my God, I didn't know all this. I've learned so much about my body, so much about the importance of pelvic health. And it really, truly in a short period of time can change people's lives. So it happens on the first Tuesday of every month. And $27, less than a buck a day, less than the cost of pads for a month. And a lot of people have then eliminated their pad expense.
That's amazing. And what an amazing deal for that. Awesome. All right. So thank you, Kim, for being here. Please let people know how they can get a hold of you.
Vaginacoach.com is my website, and basically all of my social handles are Vagina Coach. If you go to Google and put in Vagina Coach, you'll find me somewhere: YouTube, Instagram, Facebook. I do have a private Facebook group called Box Talk, and it is a safe place where people can come and learn and connect and ask questions. I go live once a week answering questions from the members. It's a very supportive community where people recognize they're not alone in this journey, and they can learn from others as well as myself. And so that's where you can find me.
Is that a free or a paid group?
That's a free private Facebook.
Awesome. Okay. Yeah. What's the name of it again?
Box Talk.
Awesome.
Yeah.
All right. So everybody, please reach out to Kim. She's amazing. And all women need to have this information in their corner so that we can have a healthy pelvic floor the older we get. Thank you, everybody.
Thank you.